What is stage 3 lymphedema? This question was thrown to me. My name is Matt Cash, lymphedema therapist with Lilly Clinic in Roanoke, Virginia. And here are the stages of lymphedema: 0, 1, 2, and 3 for both the upper extremities and the lower extremities. The staging system is from the International Society of Lymphology, the ISL. And there are 4 different stages. The first one is latency. That is 0. What that means is the lymphatic system does have some involvement. There's something going on, but we're not seeing swelling at this point in time. So it's really hard to even know something's going on unless you're a high-risk patient. High-risk patient, cancer survivor, surgeries, things of that nature. Stage 1 lymphedema, you could get a better look here if I get out of your way, but this is known as spontaneously reversible lymphedema, stage 1. Swelling is present. It usually is pitting. Usually the further away from the body is where you're going to get the pitting. So on the top of the hand, around the wrist, or around your ankle bones. Under those ankle bones, your malleoli, love to hold pitting edema there. But the thing with stage 1 lymphedema is that when you go to bed, it goes away until you put your feet back on the floor. The reason for that is when you eliminate the effects of gravity by laying horizontal rather than being vertical, your body, your lymphatic system is able to work better because it's not fighting that force of gravity to remove that fluid. However, stage 2 lymphedema, which is spontaneously irreversible, swelling is no longer resolving or going away with elevation. It's staying. So you go to bed and you wake up and it's still present. This is also when the tissue starts to become more firm and fibrosis starts to develop. You might have some heaviness, some tightness in the limb at this point. And fibrosis is the thickening of the skin. That's where it starts to get denser. Your skin should be nice and pliable. I often say in my clinic, I love wrinkles. I always get the look when I say that, but it's true. Our skin should be able to wrinkle. And at this stage, it's not doing that anymore. Stage 3, the question: what is stage 3 lymphedema? Stage 3 lymphedema is known as lymphostatic elephantitis. This is your elephantitis, the very large legs, but it doesn't have to be very large. It doesn't. What we're looking at is actually significant tissue changes. So if you're looking at the picture, I'm going to show you. Look at these pictures. You can see it, but I don't think it does a really good job. If you touch that skin, I guarantee it's pretty darn hard. But let me show you another picture. This person has stage 3 lymphedema with significant skin involvement. And if you saw Miss Chatty's video or my other gentleman with his foot, those are significant cases of stage 3 lymphedema. And what you're seeing, you could see those bumps. Those are called papillomas. If we were to get a better look, Miss Chatty has hyperkeratosis. That's what I'm removing in those videos. The fibrosis of the skin is really dense. You definitely see some color changing. We get deep in folds. Lymphorrhea, that was the Jeopardy question the other day. Lymphorrhea is when the weeping coming through the skin, out the skin. At this point in time, these legs are highly susceptible to infections such as cellulitis and also wound development. This is treated, and that's kind of what this picture is showing, that this person went to therapy and went from this to that, probably after months and months of treatment. This is what we do in my clinic with complete decongestive therapy. This is the most difficult lymphedema to manage. That's why awareness matters. The sooner you start to get treatment, we avoid getting to this point. Nobody should get to this point. That is the point of Lilly Clinic's awareness campaign. No one should have legs that look like this. No one. It's completely preventable if we have awareness and if providers are making referrals to certified lymphedema therapists, so we don't have patients that get wounds, infections, and certainly a significant impact on their day-to-day lives. I hope that helps. Thank you.